This is a presentation about the WABC assessment of basic concepts, or the acronym WABC. The author is Elizabeth Wigg, the publication date 2004, publisher Super Duper Publications, and it's the first edition. The price for all components included is $229. This is a picture of the components included in the assessment, and they include Level 1 and Level 2 storybooks, 50 Level 1 and 50 Level 2 record forms, examiner's manual, clipboard with calculator, puppy bank reinforcer, and an awesome WABC tote bag. The intended population is split into two levels. The first level, the children ranging from age 2 years 6 months to 5 years 11 months, and Level 2, children ranging from 5 years to 7 years 11 months. The purpose of the test is to evaluate a child's understanding and use of basic word opposites and related concepts. These are the building blocks that children need to be able to follow directions, engage in classroom routines, and provide descriptions. It's important so the children can execute everyday tasks such as listening, speaking, reading, writing, and arithmetic. The standardization of WABC sample population has a sample size of 1,200 children, age range of 2 years 6 months to 7 years 11 months. The number of males is 550, and the number of females is 648. The geographic regions of the United States sampled is from the Northeast, West, Midwest, and South, the majority of the children being from the South. Racial and ethnic characteristics that were sampled are white, African American, Hispanic, and other, the majority of the children being white. The mother's educational level sampled was no high school, less than 3 years of college, and 4 or more years of college, the majority of the children being with the 4 year or more of college. And the dominant language spoken in their home was English as a dominant language, Spanish as a dominant language, or other, and the majority of the children had English as a dominant language. Concurrent validity of this assessment, it compared BOEM Preschool 3 to WABC Level 1 and BOEM 3 to WABC Level 2. And all pairwise raw scores for the BOEM 3 preschool and WABC Level 1 and BOEM 3 and WABC Level 2 were correlated significantly. The predictive validity of this assessment, it measures of specificity, sensitivity, and total correctly identified were calculated at 2 standard score levels. The first level was set at a standard score of 85, and the second was set at a standard score of 77. The measures of specificity and sensitivity are the highest for both levels of WABC when using a standard score of 85. The settings where children are being taught or given childcare, preschool education, classroom or language resource services with WABC total standard scores between 85 and 77 may be identified and grouped for intervention in the existing educational setting, and children with WABC total scores below 77 should be referred for an in-depth language evaluation. At minimum, these low-scoring children should be provided with individual attention to develop the basic concepts of language. The test-retest reliability for Level 1, the correlation R for receptive, expressive, and total scores were all pretty high. For Level 2, the correlation of receptive, expressive, and total were ranging from moderate to high, and the moderate correlation for the receptive scores reflects the interpretation had reached a ceiling with no further growth, and the high correlations for the experiment total scores present strong evidence for the WABC test-retest reliability. The internal consistency coefficient alpha describes the degree of consistency in what individual items measure. All coefficient alpha reliabilities are significant, but they vary in size across ages and for item types and scores. The values of the coefficient alpha suggest that a given child's relative level of acquisition of basic concepts when compared to his or her age peers should be based on the total test score obtained and the level administered. The inter-rater reliability was computed from 3 speech-language pathologist examiners using the recorded responses for 66 children across Level 1 and Level 2. All the inter-rater correlations were significant, and the results of the inter-rater reliability study indicate that trained examiners are highly consistent in scoring the WABC receptive, expressive, and total responses. The administration procedure, the administration time is from 10 to 15 minutes. When testing, the story page should be placed or held directly in front of the child so the child has an easy view and easy pointing distance. Some children may want to help hold the storybook, and this is acceptable. The examiner and the child are able to engage in conversation when the story is being introduced and during demonstration of test items and after the story has been completed. The directions for eliciting the responses to the test items must be read verbatim with a natural intonation pattern and voice. Subtests in the assessment. This assessment groups 113 basic concepts into two sets, Level 1 and Level 2. Each level assesses receptive and expressive across 7 different sections, which are included on the screen. The scores provided are in the examiner's manual, and they are in the back of the book on pages 57 to 98. And these norms are included into charts that are split up by expressive, receptive, and total data and ranges of children's age. And these scores provided are raw scores, percentile rank, standard score, upper and lower limit, and age equivalent. Utility of this assessment. This particular assessment helps to distinguish inabilities with understanding basic concept terms from ability to follow directions. The understanding of basic concepts is a building block, so the awareness of this difficulty is then critical to helping the child succeed in their later education. The test is presented in a storybook format, which provides the test to have a wide scope of where it can be administered. The benefit of this for a child is that you have the opportunity to test the child in a natural setting. To prepare for the test, you should get all the components I told you before, but to get the appropriate storybook, so Level 1 or Level 2, and the appropriate record form. And this depends on the child's chronological age or the limitations of the WABC is that it does not include content or construct validity. Construct validity is the degree to which a test actually measures the theoretical concept under investigation. Construct validity is the foundation for test development, so without this you do not have a strong enough argument that this is a good assessment. And also content validity is typically subjective opinions from experts, and without this you have no expert guidance on if the test is accurately displaying the basic concepts of the children it assesses. Cautions while using this assessment. I would keep distractions to a minimum since the test can be administered anywhere. Make sure any distractions are out of sight and intrigue the child with the colorful pictures of the storybook. Also, since the child is allowed to speak while the test is being introduced and during demonstration, please keep the children intrigued in the testing section. And that's all.